Have you ever wondered, how does childhood attachment style affect the ability to build and maintain relationships in adulthood? It is actually a widely debated question, and much attention has been placed on it. So the following presentation shall discuss how childhood attachment style is linked to building and maintaining relationships in adulthood. Without further ado, I shall discuss how the research article I have chosen responds to the question. The title of the study I have chosen to talk about is Linking Lack of Care in Childhood to Anxiety Disorders in Emerging Adulthood, the Role of Attachment Styles. Adriano Schmanti and Antonio Bifuco researched on this study in 2015. Defining the key terms in the question first, generally the lack of care in childhood is equivalent to childhood attachment styles of insecure anxious attachment and insecure avoidant attachment. This is also known as anxious ambivalent attachment, and it is worth taking note of this phrase as it will be a keyword in the study. The study will link the care of childhood to anxiety disorders in emerging adulthood, which would logically lead to difficulties in building and maintaining relationships in adulthood. First, some background information. Why is this research important? Researchers have debated over the many causes of adult anxiety. It is a common idea, however, that the root cause of adult anxiety stems from experiences in childhood. Some differences in causes could include childhood experiences that leave uncertainty or a sense of protection, such as emotional neglect. Past studies show that securely attached children are less prone to anxiety disorders even after experiences of neglect or abuse. In contrast, children with anxious ambivalent attachment styles are directly related with anxiety disorders, even across age groups and cultures. Another cause is the overprotective or overcontrolling parents that may spark a converse response in children. Instead of feeling protected, they grow up getting overly dependent on their parents and thus feel anxious when their parents are not around. Other causes also include parental loss, neglect, sexual abuse, physical abuse, or psychological abuse. So, how are the causes of anxious disorders relevant? While having an understanding of specific developmental pathways leading from emotional neglect in childhood can boost the development of effective preventive measures and treatments to prevent the onset of disorders in following life stages. There is thus a need for a developmental model of anxiety targeting early deterrence and management in children's gradual transition to adulthood. Importantly, the aim of this study was to address the impacts of insecure childhood attachment styles in projected anxiety disorders in adulthood, and there were two main hypotheses. Firstly, that it was predicted that parental hostility and rejection equated to emotional negligence in childhood, which would then lead to anxiety in adulthood. And secondly, that anxious ambivalent attachment style would mediate statistically this relationship. So, who were the people involved in this study? The sample population consisted of 160 youth, of which just over half of them were female, aged between 16 and 30. The majority lived in the parental home, and the rest of them were part of the working class, were in education, married or cohabiting, or had children of their own. Most of them were white UK born, with 14% from black or minority ethnic groups. There were three main interviews for the methods, and the first one was the structured clinical interview for DSM for Axis 1 disorders. The SCID1 is the most utilized structured interview for assessing symptoms for anxiety disorder classification, and it was thus suitable for the study. Childhood experience of care and abuse interview was used to assess childhood adversities before age 17, and it included assessment of antipathy, neglect, role reversal, physical abuse, and psychological abuse from different parent figures, as well as sexual abuse from any perpetrator. It is proven to be a reliable measure of childhood experience in adults as well as in adolescents, with good validity and inter-rater reliability. The last interview method is attachment style interview. The ASI interview is a standardized method to assess attachment styles in adolescence and adulthood, and it's used in both research and practice contexts. It has adequate convergent validity with self-report measures and of adult attachment styles and romantic attachment attitudes, as well as a good predictive validity for psychiatric disorders, including anxiety and depression. In this study, all the ratings made were discussed at consensus team meetings, blind to psychiatric disorder outcomes or childhood adversity, which increased the reliability and the consistency of the rating. Key results from the finding showed that participants who showed an anxiety disorder in the last 12 months had higher rates of severe parental antipathy and neglect during their childhood, but not role reversal, physical, psychological, or sexual abuse. This is reflected in the table of results in the study, whereby participants with anxiety disorders scored higher in all factors of anxiety disorders. The largest difference was in parental antipathy, as seen from the red oval. In conclusion, both hypotheses were accurate. First, participants who showed an anxiety disorder in the last 12 months had higher rates of severe parental antipathy and neglect during their childhood, but not role reversal, physical, psychological, or sexual abuse. And parents who were trusting and emotionally attentive to the needs of their child would help him or her to develop positive image of the self. Conversely, if the child felt rejected, an image of self as unworthy of love and others may be constructed as well. Secondly, anxiously attached participants were indeed subject to more antipathy than other participants in their childhood. In the evaluation of the study, we were able to see a number of strengths, which include the wide range of contextual measures, which were useful in the studies as seen by the 3 interview methods. Secondly, their hypotheses were accurate and paved new ways for future research to help potential adults who may suffer from anxiety disorders to cope with it in the early stages of their lives. And lastly, there was a diverse sample population. However, there are limitations to the study as well. Firstly, there was a highly selected sample of participants, which led to difficulties in replicating the study, and thus findings have yet to be replicated. Since most of the measures were interviews, there is also a high possibility of self-reported bias. And there was also the assumption made that anxious attachment style precedes anxiety disorder, and other factors are not considered. This was an important weakness in the study, as with significant life events and changes in social competencies and relationships, there could be significant change in attachment styles over the growing process, which were not considered. Thank you for listening. So in conclusion, to answer the question of how childhood attachment style affects the ability to build and maintain relationships in adulthood, the study shows that children with secure attachment style in early or middle childhood are typically able to build and maintain relationships much better than children who have insecure attachment styles. And the study also opens our eyes to if the considerations in the study were accepted. The clinicians treating anxious children or young adults may wish to consider how working through anxious ambivalent attitudes like fears of rejection and separation or preoccupation with relationships could help their patients in feeling more secure and self-confident. Also serving as a base for fostering therapeutic alliance and allowing a deeper elaboration of those possible childhood experiences of parental coolness criticism, and rejection that can exacerbate the anxiety symptoms.